Well, greetings again, Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk about just impacted teeth, the mechanics that we showed in an earlier video here, how we use, there's several different things. We pull on the tooth going in a certain direction, and we make a space for it, and we put a little eye in the arch wire, and we pull that into there, and that pulls the tooth in this particular space, and there's a constant pull on it, and we put the hook on the tip of the teeth, or as close to it as we can get, and use electrosurge to cauterize the tissue, go in and etch the tip of that tooth, or the close to you can get on it, and bond the hook on it, and have the hook come out. You make the hook where it comes out where you want it to before you bond it. Thanks now, and let's get going on this case. This is a real nice lady, and here the situation is, we starting in, she got, of course, a tooth crowded out here, and it's bumping these teeth. What if she doesn't have a CMJ problem with it like that? And we come on the right side of the mouth, and this is almost an ideal situation with the cuspids coming down in here, and the upper molar sitting against this, and back just about has the 6 keys of occlusion in it. On this side now we've got a variation in there, and so we've got a palatal separation thing going, a palatal suture going and twisted over in that direction. And so we're going to try to straighten some of that out. Now let's get on here. Now we've got a crowded problem down here at the bottom, and we've got some difficult situation over on this side, right there. Now this looks pretty good on the left side. We'll open that up and get tasted. This was done in 1989, and this is the, let's see, this is the date of birth though. All right, here we're coming in, and we've got this impaction back in this area back here. So we x-ray it. I think we'll show you that on down the line of ways. And we're opening the space for the tooth. Now here you come with this little loop, and now we put this spring on to open the gap for it, to make it maybe even bigger. We push the center line over in this direction as we come in here. Now we'll have to come back and put a spring on the back and pull it up and go through here and go up and tie that to that deal. You'll have to study how this is made and everything. It looks complicated, and I don't want to scare people off of it. You can do it, and you take it apart. It's not such a complicated thing. Now, we make these little wire hooks out of 14,000 soft stainless steel wire. And you take this, that's a 0.014, 14 thousandths. And you twist that stuff down, put a hook in it where you can, and have it ready made and everything to bond on before you actually go in there and bond it. And we trim the tooth out like this and cauterize it, go in and etch the tooth, put this bonding material, a lot of extra on it, push it right down that tooth and bond it. Then we can reach in there and hook it and pull it over to this direction. And we can take the hook off later and make another hook and catch that and pull the tooth up into that space. And you've got a constant force here. This, pulling on this spring right here with a certain amount of force, we show you how you use an Orthodontics gauge, and this force will stay just about the same. The only thing that reduces it as this tooth moves out here, this gets shorter and shorter, and that reduces the amount of the pull, but it's a constant pull in a constant direction the tooth is going. And that's the best thing I've ever come up with on the impacted teeth. All right, and by the way, as we straighten this out, look how much better this has gotten in the center of the tooth right there. Now we've got the lowers lined up now in good shape, and we're pulling out. We hook this spring on the back side of this molar, and we've got another problem in here where we're missing a tooth there, and we're going to pull that cuspid in that spot. And so we've got an arch wire with a step up in here, and you come over in this area. We're opening this gap, make it plenty wide to get it in there, and then we'll come back and snug it up after we get the tooth there. And this is done with all spring pressure and everything. And by the way, this spring pulls this arch forward slightly in that case. And now, if we put a rubber band here and we go up and pull it, this pulls the lower jaw forward, and so we've got the constant deal over here and here, so both jaws are moving forward with this side of the mouth over here, and this is how we're going to straighten that palate out up above. All right, we're going to step up arch wire in that area. And you can see that tooth will come right on up to that spot. And this is 1989. And we've got just a little gap here. Need to get it over to at least that part. This is working over here. Now the tooth has come from a good ways out. We get it up here close. When we get it, we took the spring off, the wire off, and we hook it onto the bracket. We got bonded on the tooth, and we'll pull it right on up into the gap there. Now that's the bottom. We'll put it against that. This is coming around. See, it's coming in this direction. The wax dental floss is the secret of this thing. Man, that stuff will slide over that hole with very little loss of the force on the impacted tooth. Now we got the tooth here. Now we've got the tooth up to this spot right here, and we have it here. We have to turn it around. And sometimes you catch it while it's back here and start turning it as it moves into the hole. But here we put it up in like that. Now we'll come in and put another deal on it to rotate the tooth into the hole. I think we'll show it. All right, we've got it in there now. We got it rotated. Now, this area fills in. You can see this little attachment we've got. We're trying to pull this tooth in this direction. So we hook something over here. Let's see, I'll take that back. We're trying to go in this direction here. And so we hook this thing up and come around here, and it hooks in it, and it's turning this tooth in this direction. Maybe I'll show it better over here. Now we get it pretty well close. We use a the brackets here, these porcelain brackets, and we can tie, make sure it is. We can finish rotating that and bring it down. Now, if you remember back how this was, this is almost straight. Now, we move this over and it changed the whole palatal portion of this down here. Now, this tooth is kind of irritated at that point, and we'll look at it later. Now, here we are in 1990, 10 of 90, and let's see what the tissue looks like on this particular tooth. We got a little extra tissue going down there. We might have to trim that a little bit. Now, look at this here, right here, straight up. This looks a lot better, and it'll get better as she takes care of it and everything. All right, and now we held this space open, you see. You see this cuspid sticking way up in here. So we put the hook on right there and pulled it down into the space. This is the centrals, the laterals, and we moved these bicuspids back, but we kept the space for this tooth to come through. So there we open that gap, and we'll keep this part of the way. Now we pull that cuspid down into that gap, and now the space here is pretty small. You can enlarge the crown on this and touch both of these teeth, but that's best if you come in and put an implant or a bridge or something in that area. So here we are in 12 of 90, and we're just about to finish the case up. And we leave this gap right here for her to bridge up. We put a retainer in here with a little pad of acrylic to hold that gap open till she gets the bridge put in that area. And here's the lady's facial structure after we finish. Now, these impactions are, you need to practice doing this. Now, if you're in the area and you've got plenty of old surgeons, you can work with them. But I did all this impaction work all my, we never sent any of them. Well, I take it back. We sent a few, and they would bond a chain on them to bring it in. But I had rather work on them and put a bond, a twisted hook like that. And when it gets up close, you cut it off and short and put another hook in the wire and put it right on up to the wire. Thanks for watching, and I'm going to hang up here and say good day for the day, and then we'll get you back later. I hope you'll find something interesting in this. Thanks for watching.